Age is a question that a lot of women bring up for breast cancer surgery, and while age is not the limiting factor alone in our decisions, it certainly plays a big role in how one recovers after surgery. Well, how age affects breast cancer surgery is probably a question I would divide into two parts. First would be how age affects what surgery we can offer to patients, and the second is probably how age affects how a woman recovers and heals after surgery. So I'll tackle the first part first. Age alone is usually not the limiting factor on what we can offer patients. We usually take into account things like the tumor size, the size of the woman's breast, her other medical problems, the biology of the tumor. Multiple things go into that decision. So if a woman is otherwise eligible in terms of the tumor size for a lumpectomy or a mastectomy, we'll offer either one, and we take the patient's preference into account to make that final decision. So I wouldn't say that age alone limits them. On the other hand, though, sometimes age comes with a few more medical problems, and that can certainly weigh into what we decide for a patient's recommendations. So if we have a more elderly patient who has more medical problems, a lot of times if we're looking at a lumpectomy or a mastectomy, and it looks like it would be more difficult for that patient to recuperate after a longer surgery, let's say from a mastectomy, then we'll favor a lumpectomy for that person instead. The second part of the question kind of tackles what the recovery anticipation should be for patients depending on their age. You know, many younger women have more strength, more energy, and can bounce back from surgery a little bit more quickly than our elderly patients. Although to some degree, our elderly patients have less pain after surgery. Some say because as you get older, your pain fibers fizzle out a little bit. And so generally, both age ranges heal very well after surgery. It's just important to make sure that you're in as healthy of a state as you can before surgery to aid your recovery after surgery.
Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
About personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.